Hello, friends. A very good day to all of you out there, and a very warm welcome from the entire team of RFA Tutors, your mentor this side. Thank you so much for joining in, and a warm welcome from all of us. I hope the voice is clear now. I have been seeing the chat for the last 10 minutes and giving a smile that how is it going to be when I'll come live to you guys. I know that it has been lots of patience and lots of waiting for this session. I do understand that introduction was the most awaited for all those who had been joining, and you guys today are starting up as a big family of 432 MRCT2 aspirants in one study group when we are just having an introduction today. Thank you very much at the very outset on having faith in RFA tutors, on having faith on this very humble lead and mentor for you guys. I'm here to give all my support, all my guidance in my humble capacity to make you successful in Mrcog January 2027. Thank you so much for joining in. I have all here. Thank you very much. The strength of MRCOT always goes 1,500 to 2,000 when it comes to the part two students globally. And when you see in the Pearson Center, you're always like, ma'am, I knew everybody was from RFA. Again, I would say I'm not capable. It's just the efforts that have been. And when you'll see the course and when you go through that gradually, when you'll see the sessions, you'll understand that it's not a matter of one day. It's an effort of months, sleepless night. Before I begin, I have to say congrats and a big, big thank you to my backend team who had been sleepless. The welcome pack, ladies and gentlemen, which you see on your portal, let me tell you that it had been sleepless nights of 10 days that they had been making, and still the mentor was not improving because I wanted more things to be added. By the way, how many have seen that welcome pack on your portal? How many of you have clicked on that welcome pack on your portal? And how many of you have seen that? Thank you very much, Anupama. Alia, well done. If you see that, you're going to be spot focused on your preparation. Wanted everything to be very organized, very smooth, because I do understand when I was a student back in 2018, it's been years. I call myself an old mentor mommy because my students all over the world, they are flourishing, and I'm proud of you guys doing the best globally. I do understand when I put myself in your position that how difficult it is with families, how difficult it is with the working chores, difficult it is with the hospital rota, difficult it is with the environment which we have, unfortunately, in gynecology and obstetrics, pursuing the specialty and studying again. Nevertheless, we are together in this journey, and you will find lots of empathy, lots of support. You won't feel that it's a study pattern going on. At the end of 6 months, you will start missing each and every member of the group. You will know who talks a lot. You will know who asks a lot. You would know who studies a lot. You would know who supports a lot. And behind all this, I will be standing there to guide you step by step every time. Thank you so much. A warm welcome once again. Thank you very much, Anam. Love you guys more, Danyan. Thank you very much, Nidhi. Big hello. I'm glad to see you guys here. And I'm grateful that you all have been having the bond of love with this RFA alumni. And again, I'm grateful to all the energies which I get in response to the efforts which I make. Thank you. All right, so we are here together to take one oath today. We are here together to make a family strong with the aim of successful MRCOG to January 2027 results. Right, Anika, Mira? They say that before you start anything, you always have a dream of it. I'm not sure how many of you are pursuing because you want to do MRCOG. How many of you are pursuing this as a career because your husband or your wife wants to see you as a MRCOG? How many of you are taking this step because your parents want to see you as a MRCOG? Today is the time when we are taking this step, and let me tell you guys, there's no turning back. I would not say that it's going to be a smooth journey. I would be very open, very honest to all of you. The journey would have ups and downs. The journey would have hurdles. The journey would have days with smile, and the journey would have days with tears. The journey would have sickness days. The journey would have days with full health. The journey would have days of depression, but the journey would have days full of togetherness. We should be ready for each one of that because this is life. This is how the things are. It is a challenge. Do not expect it to be easy, but expect it to be doable. Why? Why, friends? Because we have a dream. The dream only comes true. In my dictionary, there is nothing as failure. In my dictionary, you just have to remember that everything is doable if you put in effort and you don't lose hope. And this is the type of attire which I'm strict at, which I am very, very serious and strict on the feeling and on the focus that you guys are not going to lose hope no matter how backlog, how much it is, how much difficult it is to cope up. We would fight and fight till the end. And I give you my words. If you give me your 100%, nothing can beat you. Nothing can stop you to be successful in this exam. There are so many Mrcog's. Everyone out there has had the share of their sacrifice. Very well done, Anupama. That's like my students. And I'm proud of you guys. It's just a recap. I feel that every single time, every 6 months, Suzanne, I'm taking the exam again. And every time I put myself into the same situation, I'm sure that you guys know many of them. Starting from 2025, I've put in the results. I cannot count up till now how many successful students it's been. When I see the roll of honor, it must be above 30,000 alumni all over the world. All of these, your seniors, your juniors, your colleagues, they had been here. And if I go back 2023, 2022, 2021, the highest scores, the gold medals that had been by alumni. And if I see those highest scores, and if I just have a blink of an eye, it seems like that it was yesterday. And I'm glad that I would be expecting you guys in the next champion board, I'm sure in 6 months' time. For that, I cannot do this alone. I need your support. How many of you are all together with me on this, are ready to listen to my scoldings, are ready to listen to my strictness, are ready to have hands in hands in this journey? You'll find me a very lovable mentor and at the same time a very strict mentor when it comes to studies, because myself, I have applied it to myself when it comes to my studies. So I want you to be in this same set pattern to be successful. May is asking a question, and I have that in FAQs today. May, it's not your question, sweetheart. Every single student does ask this question to me. And I think that's the first thing that comes in mind. Let's begin. Let's see that what do we have. I'm going to unmute each one of you after the end so that you listen to me first. I'm sure that you've got a lot in your mind that you want to discuss. I would have a suggestion that please write it down in a piece of paper. And once I give you a chance, and if I've not covered up in the session that very point, please do ask that in the end. Okay, so are we all ready to begin for the introduction? Yes, the mentor is known as a motivational speaker. So please be ready even in the live sessions to scold you, to keep on bringing that inner best out of you. Ready, Anika? Thank you very much. All right, so I've seen students passing the exam, ladies and gentlemen, in 3 months' time. But I would not say definitely I'm a big mommy, global mommy for all of you. I do not suggest taking a hasty attempt when it comes to Mrcog 2. I see lots of successful stories generally in 6 months, Sumaya. but 3 to 6 months is generally doable depending upon that how much time you can give. I just got a question around 30 minutes back. A student was about to join, and she asked me that, may I know that would this time be sufficient? And I asked a question in return that before answering your question, I want to know that how much time can you give to your studies? So it totally depends on you. There's a student who is giving 12 hours a day, and there's a student who is giving 10 hours. There's a student who's going 3 hours. Of course, it makes a difference in your complete study plan, right? 3 months minimum, 6 months, it is doable. But when I say 6 months, definitely you have to follow the way. We are going to do 4 set of revisions for you guys. And you have to understand the way you have to learn the things. We will make weekly goals. We will make the concepts clear. We would be practicing side by side. We would be tracking our progress and move ahead with that. There are a few students who are at home, and there are a few students who are actually employed and are working. There are students who are working, but they've got more offs and they have such clinic duties. They're not in the hospital rota. So it's absolutely dependent upon how your routine is, and according to that, how much time you guys can give to the studies. So if you ask me, friends, dedicated applicants, if you give 4 to 6 hours from today, 4 months, you can complete the curriculum. But if you are the ones who can give 3 hours a day, for now, for these 2 months, the month of July and the month of August, it's okay. You would be able to do that, right? However, it shouldn't be only hard work. I always say hard work is essential. Nobody can pass without the hard work, but equally smart work is important. When I teach, I don't teach for the sake of completing the topic. I teach for the sake of making your memory. And I'm not sure that if you've seen the feedback after the exam, that every single student was saying that I was sitting with them in the Pearson Center. The voice was ringing in the air with every line of the PowerPoint, with every explanation of my pen, with every writing on the screen. They could comprehend and they could remember the words. When I am making an effort that my teaching should not be just for the sake of completing the topic, it should be drilled in each and every neuron in your brain. Gynae and obs should be a different approach after my session for you guys. My expectation is that when 70% of the task I'm doing, the rest of the 30%, you have to make sure that you revise it, you rehearse it, you practice it, you apply that knowledge. This is my minimum requirement from each and every one of you out there. Right? When I say, I'm sorry, guys, I'm not seeing the chat at the moment. If the questions are there, I'm extremely sorry if I'm not going to take them now because I'm concentrating on telling you the introduction. Please make sure that you do write it when I'm open to the questions, right? Anika, Swapna, okay? All these questions, when I end up the introduction, please do ask them because I won't be seeing the chat and won't be taking the questions in between the intro, okay? So the exam format is basically single best answers and extended match question. When we were students, and even 2 to 3 years after that, in my initial years of mentorship, since 2019, 2020, in the COVID times, 2021, 2022, extended match questions used to be the biggest fear. Still, till date, we do the EMQ guidance, we explain a lot. These EMQs are always challenging because the time constraints are there, the difficulty in understanding and, doing the options separate, that's always tough for the students. But for the last 4 exams, 2024, 2025, 2026, unfortunately, with the extended match questions, the single best answers had been equally tough. To an extent that in the recent exam, we had 24 new single best answers in paper 1, all from the TOG articles. Tog articles, AI, Tog articles, Tog articles with the lots of carbon footprint. There's so many things were new from the scientific impact papers, and students, they did find a little difficulty. With every passing day, the exam committee has made a change in the format that it's not only theory, it's more of a clinical understanding, and clinical scenarios are more, right? Therefore, you should be knowing that when we come to the exam, you're going to have 50 SBAs to begin with, and then you will have 50 EMQs next for the same exam. This would be your first paper. All right, this is going to be your first paper. And then again, you're going to have 50 SBAs, and you're going to have 50 extended match question, and this would be your paper 2. Paper 1 and paper 2, both of them are 3 hours. We have a break of 1 hour in between. I hope I'm clear. I repeat once again, you've got 3 hours first paper. For the last 2 exams, it's not gynec and obs separately, everybody. Initially, when we were taking exam, it was gynecology, 50 SPAs, 50 EMQs. Right, ma'am? Second paper after 1 hour break, 50 SBAs, 50 EMQs. Right? But now, for the last 2-3 exams, the SBAs are from gynecology, but the extended match questions are from obs. Similarly, in the second exam, the SBAs are from obstetrics and the EMQs are from gynae. So they are mixing in one paper, half of it gynecology, half of it obstetrics. So there's no fixed pattern. You can have a complete gynac first, a complete obs first, a complete obs first, or a complete gynac second. Got it? Or it can be 50 from one part and 50 from the second part. Could I make myself clear, everyone? So the exam format should be clear. However, the modules are not clear. Modules are not fixed. It can be mix of the gynecology and obstetrics, but total 50 SBAs and 50 EMQ in paper 1, 50 SBAs and 50 EMQs in paper 2. Did you guys understand that? The first step to pass the exam is to understand that what are we being assessed from? Ma'am, Swapna, Tamana, everybody clear? Did you guys understand that, everyone? Yes? Clear? Perfect. Now, the curriculum is vast, to be honest. But again, as I said in the beginning, that we all have done it, right? So the curriculum is vast, but it's doable. You should understand, Mariam Said, Seema Zafar, that what is the first thing that we need to understand? The problem with students they face in MRCOT Part 2 is because the curriculum is huge. So what happens, Ala, is that we learn, and we forget what we do previously. This is the problem. You're starting your journey today. You guys would be so happy starting up with this journey. Somewhere in the middle, the depression would come up and it would turn into anxiety. Why? Why? Because what you have done here, that is all volatile. And you're like, ma'am, all the old thing is gone. We literally don't remember what we did in those GTGs or NICE or talks. What is the solution? And I'm telling you, this would happen. This would happen. As per my experience, I would see that people who would not follow judiciously the daily schedule. So who are the smart students then? Who are those students who would avoid having this phase after this phase? The ones who go like this. And this is my technique always in studies. This is the daily schedule. You're going ahead with daily schedule, and with this daily schedule, what you'll do is you'll make a parallel line. When you reach here, you start revising from here. When you reach here, you start as a second revision from here. 30 minutes, but recap is must. And you start doing the parallel things. no matter 15 minutes, no matter 30 minutes starting from the beginning. I can write it down for you guys today. Nobody can beat your memory. We have got literally a blessed brain by the Almighty. We don't know how to use it. And we are no understanding how to make it easy, making sections in our head. We have to understand the technique, friends. We have to understand that if we keep on doing new things and we are not revising the older things, definitely we are humans, we will forget. And it creates anxiety, it creates stress, it creates the pressure which affects our performance in exam. Are you guys with me? So you have to understand, if you're a type of a student who makes notes, it's all right. You have to make that, but then you have to revise that. You have to understand that recommendations are very, very important. Extended match questions, equally single best answers are very important. And we have to learn that from today. When you are heading towards a Mrcog 2, you should understand how to go about that. The most important question which I get is about percentages. How many of you today are scared of percentages? That how we are going to learn all the percentages in the guideline? Anika, very. That's it? Only Anika? Asma, a lot. Sana. Okay. Have you done some homework? How many percentages are coming nowadays? Okay, let's go back to 2018. I have, ladies and gentlemen, 17, total 17 percentages in my exam, but almost every single percentage was a recall, was repeated. Nowadays, for the last 3 exams, you guys are fortunate, not more than 4 questions are coming up from percentages. So out of 200 questions, if 4 questions are coming from the percentages, and if you're concentrating on the percentages so much that on the cost of it, you're forgetting the main data, it is not a wise approach. All right? It is not a wise approach. So when you are learning with me, I will make the PowerPoints. I'm working on your early pregnancy, the first session now. You get a guideline and you see the percentage. Forget it. I'm telling you, simply forget that percentage. And what do? Make a separate percentage notebook and just put GTG 17, that percentage. That's it. That's it. You don't have to do anything. Just put it aside and forget it. Just in the last 30 days, we will open it up. And we'll start doing page-wise. Every single percentage is not needed, please, because that is not expected from you. But at the same time, I want you to be smart. That when percentage comes up, just put it on a side. Make your wonderful percentage notebook without putting pressure on your head. We will put pressure, but we'll put pressure in the last 30 days. Clear, everybody? That's the first thing, and I hope you guys would remember this and this question would not come up again and again. Then what percentages have to be done? Just leave it on me. I will tell you that these percentages are mandatory. That's it. You will do only those percentages, which I will highlight in my session. And I will tell you that please put it in your percentage notebook. That's it. You don't have to do all the percentages of the world. It's humanly impossible, friends. And nobody expects you to do that. And on the cost of it, when you forget the recommendations, yes, we are failing then. We are under pressure. We are under pressure for that thing which is not coming up in exam, and we're leaving that thing which is definitely going to come up in exam. I hope we are on one page here. I hope I'm making sense to all of you. If anything is not clear, please stop me and ask me. But what I'm saying has to be very clear to you before you step up with your preparation. Thank you very much, Anika. Very well done. That is what I wanted to say. That if you put attention more on what is the exam content, definitely you will be in the right direction. You keep on doing the hard work, but in the wrong direction, definitely puts us under dilemma and depression and anxiety. All right, very good, Meera. Very good, Ibtihaq. So we all would make from tomorrow a percentage notebook, and we'll put that percentages which I will mention in my session. Clear? Everybody clear? Right? Okay. Now, with this, I'm starting the curriculum now. Okay? When I do the curriculum discussion with all of you, I would tell you that how many questions from this module is coming up. And I'm going to tell you that if you do this, how much in terms of your curriculum you are actually confident in for the preparation. The first, Arunima, Anupama, the first, very well done, Anupama. I am so proud of you. The same pattern we'll do here as well, sweetheart. How to study for Mrcog, the first and the foremost thing is Green Top Guideline. I'm sorry, I cannot give you smile in this situation saying that we will leave few of them. We will not. Every single Green Top Guideline has to be covered without any sort of a fail. Must questions that come from Green Top Guideline. I'm sorry, but every single line is important. And recommendations should be like on tips. To an extent that when I ask you that this recommendation is where, when I remember the page numbers, when I remember the lines, I expect you guys to know the lines as well. The memory of the Green Top Guidelines should be so appropriate because that is the bulk of your exam. That is the major content of your exam. Am I clear? Am I clear? Did you guys understand, everybody? Yes? This is the first thing for which I cannot be easy. And when I'll be teaching, 80% of the Green Top Guideline would otherwise be very clear to you guys. Okay? But then I need revisions. Then I definitely need certain points where I would tell you that you have to revise them because they're volatile. Then comes NICE guideline. They are, yes, most important Green Top Guideline, Manu. Then comes NICE guideline. Now, NICE guideline are not as important as GTGs. But earlier, NICE guidelines, there are certain which we don't have the content in Green Top Guideline, like subfertility. I don't have a GTG. Prolapse, incontinence. I don't have a Green Top Guideline other than the wall prolapse. I have all the incontinence, stress urinary incontinence, overactive bladder, reducer overactivity only in the NICE. Then the most important part of your obstetrics exam, that is labor. And I don't have any sort of a intrapartum care plan other than the NICE guideline. I don't have any GTG on HMB. I don't have any recommendation of Green Top Guideline in endometriosis. I don't have diabetes in maternal medicine. I don't have the twins extent of the twin antenatal care when it comes to the Green Top Guideline, except a monochorionic complications. Therefore, we are going to do the NICE side by side as per module. Now, when you guys open the NICE guideline, everybody, in the end, when the NICE finishes, there are some audits written, and that is for the future development, the future research, the future work. So that can be ignored. That is not for your single-based answer. That is not for your exam. That is for the future improvement and the audit purposes, research for the NICE guideline. Got it? All right. With regards to this, Xiaomi 2411DRN 471, can I take the question in the end after telling about the curriculum, my love? Sumi, okay. Sumi, can I take the question in the end? Please copy the question and paste it when I start the question and answers. I will take each one of you there, okay? But in the middle, let me explain the curriculum so that it is clear to you guys. And then we definitely are going to address all the questions, okay? Right? So when it comes to the NICE, this is the second thing that is important, and you should be knowing about that these topics are not in the Green Top Guideline. We have to do that. Okay. So Depshari, again, my dear, I will take the question in the end. It's a very important question. Please do ask when I'm done with the curriculum, okay? right? Then comes the talk articles. Now there has been a trend, friends. There has been a change in the system. I simply feel that when I took this exam, if I go back to 2018, the exam wasn't that tough, literally. I feel, or maybe today I feel seeing the exam today, I feel that now every single exam from the previous exam is tougher. We had 90% of the exam from the Green Top guideline. More questions were repeated. Now it is less of the questions repeated and more questions that are coming from the lines of the talk article. So the curriculum has become huge. The curriculum has become vast and more effort is needed, to be honest. But again, the talk articles last 3 years are third in importance and we have to do that. I have made things super easy on the website. When any new talk article comes, overnight the RFA team sits. Overnight, they make the single best answers from the line of the talk articles, and in 24 to 48 hours, they get uploaded on the website. By reading the talk article, by making the quiz from the talk article. Reason being, so that the things are easy for you guys. Either you do the talk article and you assess that yourself from that quiz, or you don't have to read the talk article, you just do that quiz and you learn the answers. I mean, if you've got less time. We are covering the talks in a very smart manner, so that your memory is good, right? With regards to this, the talk articles are third in importance. Number one, Green Top guideline. Number two, NICE guideline. Number three, talk articles. And till the talk articles, your 95% of exam is done from GTG, NICE, and talk. Right? Now, there are certain things which make the remaining 5%, in which we have the sexually transmitted infections. Then we have the scientific impact papers. Then we've got the maternal mortality. Then we've got the NHS cervical screening program. We have got the consent, and we have got the clinical governance and statistics as well. But again, this all makes 5% of your remaining. Okay, 5% of your remaining. For this, summaries are okay, right? For example, if you go to the contraception in FSRH, only summaries are enough. There are hundreds and hundreds of pages of the Faculty of Sexual and Reproductive Health, but you don't have to do that. It's okay. You just do the sexual health summaries from the website and that's it, because this is less component of your exam and I don't want you to put pressure on this so much that your GTGs, NICE and talks, they get affected. Do you guys get that? Anupama, stats questions are 5 to 7 in total exam, not more than that. It's not that important as that of part 1, but your part 1 knowledge is all sufficient for part 2 as well, my dear. But we'll have separate sessions. Okay? Right? With this, your curriculum theory part is completed. Let's do a recap, friends, quickly. What is the most important thing when it comes to Mrcog part 2? What is the most important thing that you guys are going to read, which is around 70% of your curriculum? Very well done. You guys are amazing. I love you. Asma, thank you very much. Anu, Sana, Sarah Aslam, Swapna, Amen. That is Green Top guideline. What comes second in priority, friends? What comes second in priority? Anika says it's nice. Sana says it's nice. Mariam says it's nice. Thank you, Smriti. And Zainab is there. Thank you, Zainab, for joining in. I'm sorry when you joined in. It was just starting of the live session, so we were very busy. I'm glad to see you in the live session, sweetheart. Okay. The third importance is talk articles, and the rest summaries are in front of you guys. Okay? Got it? This is the outline. Now, with this outline, Preetha, we can't be successful if we don't assess ourselves. Right, Anupama? Escher, I will tell you where to do. FSRH is going to be in the summaries, Anupama. In these summaries, like I did, contraception and sexual health, they come within STIs. The FSRH are only summaries. Okay? The books for the Mrcog 2 go parallel. So, how do we aim for the preparation for you guys? We have the curriculum and we have the books. It goes parallel, hands in hands. We do the books parallel because practicing questions are equally important as those who are just reading the theory. Sure, Arunima, my dear. This session is being recorded, by the way. The record is going to be uploaded on your portal. It goes on YouTube as well. Okay, Arunima? So you don't have to worry. Every single session which I'm taking, friends, is being on record. It will be uploaded on your website. Okay, so you don't have to worry about that. All right. Now, coming to the book practice, the book practice is essential because whatever you have been reading, if you'll not apply it as a content, you can't be actually assess yourself that where do you stand. You know the theory, but you're not applying it on the question. You're not managing the questions and answers. You would be scanty in your information and you will be scanty in your exam attempting technique. All right? So you don't have to worry about this. We do it parallel, and I have in the end the schedule of the book practice as well. You don't have to buy these books. All of them are available in your study resources, and you can just take from there. I generally don't want you guys to do physically on the book, reason being because your exam is on the screen. So I always prefer practicing on the screen. It is a rehearsal. It is a rehearsal doing on the screen rather than doing with a pen and physically having the book in hand. Okay, so you open it as an ebook, you open it on the screen and you solve it on the screen because eventually you're going to take exam on your screen. So this is my suggestion. I don't want you to carry books because the more you carry books and you underline and you highlight and in the exam the things are different, that the screen is in front of you. So I want that from the start we practice in the exam mode. All right, okay. Swapna. We have got Sir Andrew Sizer's book, beautiful book. I love both Andrew Sizer books. Amanda Jones is one of the favorite. Sir Janesh Gupta's book is amazing, guys. Similarly, we have got Sir Mustafa's book, Mastering, beautiful. This is old Andrew Sizer, my exam favorite. Succeeding is beautiful. Extended match questions are amazing. Few question and answers. The keys are wrong, but we have had the errata in exam as well. So you've got the corrected one as well. Anupama, you are a book person. Make it ebook. Don't make it a physical book, okay? Ebook would help you for reading on the screen. It would rehearse and practice your stamina as well, okay? Make it an ebook, my love. Then Sakunja's book is amazing. You will practice it a lot in the study group. Sir Tahir Mahmood's book is perfect. I always recommend that to my European board students as well. Peace and her quality of questions are very good. Few answers are outdated, but the quality of the questions are amazing. 550 Rekha is one of the best books for the extended match question. Pilkington is amazing for certain modules like clinical governance and teaching. Similarly, Kalevani has got beautiful maternal medicine, extended match questions. I simply love it. And Peace and Her for the obstetrics and the gynecology, both are available and they are literally, I can have the page memory. Till date, I solved these questions in 2018, right? And after teaching till date, I tell students page number 40, Janesh Gupta has this question. Page number 39, 550 Rekha has this question. Page number 100, Andrew Sizer has this question. And I tell students to go to that question and see how the twist had been because you'll see the same type of exam questions. Copy paste questions, they don't come, friends, but the applied clinical knowledge, the twists, the tricks of the questions you learn from applying that info that you have been learning from the guidelines by solving the question, remember. Okay, all these questions that had been the question books that had been in front of you on the screen for the last 2 minutes, they are part of the schedule and you will do that in the study group. So you don't have to worry about that. But I need, again, consistency and I need your support in solving that with the moderator. Okay, few questions would be outdated because the books are older, like the new guidelines are there, but every single thing, yes, that's what I'm saying, Daniel, every single book would be solved during the course. Coming to the questions. Now this question, one of the students did ask, and I said that it's a very important question. Is reading guidelines enough? Should I memorize all Green Top guidelines? Or the summary is sufficient? Does clinical experience alone guarantee success? And I'm very new. I don't have the clinical experience. I've just been working for a little time and I've taken my part one and consecutively I'm taking part two. So that means I'm not going to pass. I would fail, right? If you see my WhatsApp, if you see my Instagram, if you see my Telegram, these are the frequently asked questions which I think everybody would have in the heart. To begin with, are the guidelines enough? I would say reading the guideline and then only reading the guideline is around 60% of the preparation. If you don't practice the questions, you do not understand that what from that guideline would come up in exam, or you would not understand how I have to pick that info and apply that on the question. Alone reading guideline, unfortunately, is not enough. That is 60 to 65% of your preparation. The question comes, should I memorize all the Green Talk guidelines? The answer is yes. But memory does not mean that you keep on doing that like A to Z, and then the info when suddenly asked is that you're blank. Your technique of learning the guideline should be so quick and so smart that you understand the points which are needed by exam. Now, Mariama says, can we just read the summaries and apply that on the question? My answer to it is, it depends upon which type of students you are. How many of you are type of the student, if there are 30 pages of GTG, if you not scan those 30 pages, and if you just do the 20 pages or 15 pages of the summary, you would not be satisfied. Look at Rima's question, friends. Rima says, is the summary in website covering the whole guideline? How would it be a summary if it is the whole guideline, Rima? Answer this question. I'm the type of a student, I'll talk about myself. I'm the type of a student, if I'll not read from first page to the last page, I'm not satisfied. I would keep on having that in my back of my head, I don't know, what did I leave? I would not be satisfied. That means I would keep on getting anxious. Therefore, my technique, the smartest technique, I've done all the parts in first attempt, friends. My technique is that I will read first, isolated sitting without any sort of a distraction. I would read the whole guideline first, and then my second revision is almost 50% of the guideline. I give a very good time. I give a very good time to my first read. And I'm not worried in my first read if I'm doing only one guideline in a day. I don't take a burden of that. But making sure that my second read is 50% of what I read first time, because I extract those points which are needed for the next time. And here it is the smart student. Here comes the smartness. If second read is also taking you 4 hours, then your first read is not correct, guys. Do you all understand? Do you all understand? Anupama, Rima, Maria, Alia, you're understanding what I'm trying to say. If your first read and your second read is taking similar time, then you're not having a right technique of your first read, friends. Your first read should be a point where you extract those things, and second read should be only those things which are important extracted, and third should be half the time of the second read. This is the only way that you make the curriculum shrink. That does not mean that you will leave the things. That means you will do the things and extract the things from there, which is needed more, and which is needed rehearsal and the important exam points. Everyone in the chat box who is saying that it takes me too much time to read, one day you guys have to read that guideline with me. Definitely there are distractions. Definitely your attention is not there. Definitely focus is not there. Otherwise, we all are humans. If you sit in a separate room, you would understand that if you're reading a guideline with full focus, you would understand what they're saying. You would highlight those points. There would not be any confusion because nobody takes the whole day. When the guideline is in front of you, you have to understand what is needed. And when you listen to the session and the guideline would be in front of you, you'll understand, oh my God, when I was reading alone, what was I doing? And now I really understand that I have to learn this. Now I understand what is needed from it. Now I understand what college wants us to learn from this guideline. Right? Now comes the question that if I can't read the guideline and if I just do the summary, then you have to make sure that summary is on your tips. Rather than leaving that day's guideline, if you're doing the summary alone, I accept that because you were on the verge of leaving that guideline because you were busy. Then summary is okay, but it shouldn't be a routine. One odd day it can happen, one busy day it can happen, but it shouldn't be a routine. At least cover the topic of the day. Do you guys get it? It totally depends upon Anika. When you do the daily schedule, I can tell you from there. For example, when I'll show you the daily schedule just in a bit, I can tell you from there because every guideline has got a different length. So, of course, according to the number of pages, according to the difficulty level, according to the recommendations, algorithms, the number of the length of the guideline, that does matter, right? Okay. Now, it is a plus point if you have clinical experience in obs and gynae, friends, but if you don't have clinical experience, it doesn't mean. I've got I've got surgeon students, MRCOG, who have done MRCOG with me, but they don't have the clinical experience of gynae and obs. It's okay, right? It's still manageable if you learn good, but now the questions of the applied clinical knowledge a little more, so it's all right. Still, we can manage. Now, till date, the extended match question, friends, have got more weightage as compared to the single best answers, but that does not mean, again, that we have to ignore the single best answers. EMQs, we will practice a lot, but equally the single best answers, I will mark a lot. When you will attend the early pregnancy session, I'm sure that you guys would love it and you'll understand that, okay, now we understand that why MRCOD2 is different, MRCOD3 is different when you listen to me. Reason being that that the focus and the approach towards the guideline changes. Reading the guideline with me, attending the session, that actually tells you, trains your brain that this is how the college is asking the questions. This is what I need to learn. And this is the point where I need to work harder, right? So extended match question, we have lots and lots of options. So if EMQs are there, Anupama, EMQs, they have got maybe A to S option, A, B, C, D, E, F, G, H, I, J, K, L, M, N, O, P, Q, R, S. So many options are there, and then one question is there. And in single best answers, A, B, C, D, E. So we have 5 stems, and the question is here. So basically, single best answer is the same as that of MRCOG1, but extended match question has got so many options and so many close options that in the end, you're just like, dizzy in just following that. What did they ask? What was the question? How to exclude those options? Therefore, it is more challenging because the match is quite closer in many of the options. The 5 mistakes the candidate they do is that they don't understand the exam pattern and they do one, Alia, one is correct out of A to S. One is correct, but 4 to 5 would be very closer. So excluding them becomes very difficult, right? Okay. One is correct, Anu, but the other are so closer that you get confused. When I'll practice in early pregnancy, I'm putting in field. When I'll practice, you'll understand that you'll say, ma'am, why not the other one? I mean, it's so close, but one is correct and I'll justify. I'll train you in a way that I'll justify why that option was correct, right? Students who actually are struggling in MRCG2 who have a poor exam time management. They don't work on the exam technique from the start, which I will tell you now. Now I'm going to work on that for you guys. Therefore, I was telling you that please do practice the questions on the screen because that would help you guys. Sometimes they're only reading, but not practicing the question. So in exam, they understand, oh my God, I learned it, but it's not coming in my head. I mean, I did know this recommendation, but somehow I'm not able to solve it. Once they solve the book and they get the questions wrong, they don't go back to it. They don't bother to see why did we do this question wrong? What was the reason what was the answer? What was in my mind? Why couldn't I click the right one? Sometimes too many resources makes you guys confused. Too many study groups also make you guys confused. Please, you will say to your friends, or somebody would be coming up saying, whatever pathway you have chosen, whatever study group you have chosen, please stick to it. Do not go right or left. Reason being that everything has got their own pace and everybody has got their own pace. Multiple groups, following multiple patterns that makes you confused, and in the end, you are in a fix. You are losing the exam focus. Rather than that, you are getting more anxious. Oh my God, they are doing this, they are doing this. And because there are so many students in RFA open group, unfortunately, every time students, they tell me that so many, competitors, they're there in the open group, and they start messaging privately to the students that, we'll add you in our group. We are doing this exam, we are doing this paper. And students immediately send me the screenshot. The team does try to block lots of people, but because the bulk comes here, we don't have time settling up our students, guys. It becomes very difficult, but you will face such things that people would message you privately saying that, please, you pay in our account, you pay in this, and you'll get this, and you will, get these books, you will get this. I just want you guys to be wise that, please, whatever you are studying, have faith in that, and the curriculum, please revise on your own. Do not follow multiple timetables. Do not go into multiple resources, because then you will not have revision, because already the curriculum is too much. So be wise, be focused, and please revise according to your own pattern. Of course, you've been through many exams. This is one of the toughest exams, but again, this requires your wise strategy. As I've mentioned, the students who cover the curriculum but are not able to revise them, they retain less. So I want you guys to retain perfect and focused by doing the first read properly, then solving the question side by side. When you make the question incorrect, remember that's your learning opportunity, and I want you guys to make the mistakes now. You review the questions again, you revise it again, you repeat it again, and I can write down for you guys that it will be a success. This is my way of passing Mrcog 2. This is that gold medal way which my students had been following for years and years. If you follow this technique, by the way, in between the curriculum, we have self-assessment meetings as well. And when you see those self-assessment meetings, you will understand that where do I stand when I started, what I am today. Those self-assessment meetings within the sessions are very important, which we'll do. Very well done, Alia. Certain words, they change the answer in Upama. For example, they've given a stable patient, unstable patient, ectopic gets changed. They say most appropriate, most accurate, Alia, it gets changed. Initial, definitive, Atik, you're there, it gets changed. Immediate, routine, it gets changed. So the words are so important. You do the guideline, you understand, thank you, my love, understand the question, you do the practice, you see that why you made mistake, you are going to revise that, and eventually you are going to pass. I have a question. Now, after all this discussion, there's a candidate who reads 12 hours a day. Poor candidate has left the family, has left the entertainment, has left the outing, has left all the parties, and studying 12 hours a day. And candidate B reads 3 hours, rest of the time practices question, makes mistake, reviews the question, that why did I make a mistake, and then corrects that and revises actively, studies 6 to 7 hours, which is definitely less than 12 hours. What do you guys think? What do you guys think? Who's going to pass? Definitely candidate B, right? Why? Because this is the technique. This is the memory. You don't understand until and unless you solve. You don't understand until and unless you practice. What I do is that if you open up the website, now I'm coming to the website, G2G flashcards would be there, then recap flashcards. On your website, on one page, the Green Top guideline is there, one pagers. Why did I make one pagers? That 72 guidelines are there, 72 pages, you know? And if you ask me, my ebook, 72 pages are like this. I mean, till date, if any guideline is released, if any talk article is released overnight, I do not sleep before I read this. This is the passion. And that's why I say that words of the guideline are on my tips. Reason being, because you know that how important they are, right? For each guideline, there's a recap flashcard, one pager, only one pager. The points must to learn. I've made things so easy for you guys. Before that or after that, you have a self-assessment quiz from that guideline. I want you to do that self-assessment quiz 2 times. One before reading and see where do you stand. There are 30 questions. No matter you correct only 10. No problem. You've not read the guideline. After reading the guideline, again go to self-assessment quiz and do that. Then it should be 30, not 30. This is my requirement. That from that self-assessment quiz, which we have made from that very guideline, before that, when you do those 30 questions, no matter you pass in 5 or 10, no problem. But after the guideline, it should be 30 out of 30. Then you are okay. One modular exam would be taken from each module after we complete the module. This would be the pattern that you're going to see. This is my live session schedule. You're going to start from tomorrow, from early pregnancy, everyone. We will have the antenatal care, fetal infection, maternal medicine, labor. Please, the modules are in front of you, everyone. Antepartum emergency, postpartum module, gynecology, subfertility, urogynac, sexual health, contraception oncology, surgical and post-op. These are the weeks which we have allocated, and you have whole schedule with you till December. You have each and every day clear with you how many sessions. I'm going to meet you for 30 live sessions, and with those sessions, you guys would have self-assessment separately. Aisha Hassan, just give me a moment. Everything is coming up, my dear. Every single session date is with you, 2 p.m. GMT, we are going to meet. Until and unless there is some Holi, some Diwali, some Eid, some sort of mock exam, there might be some changes in October because lots of traveling, lots of MRCG 3 exams I have to take. But other than that, these dates are always so that you can make your schedule, you can attend the live session, and you can be with me. Coming to the point that live sessions are important, or you can listen to the recording. It's absolutely okay if you want to listen to the racket. Many Malaysians, many Singapore, Hong Kong students, they do find it difficult 2 p.m. GMT because it's nearly midnight in their part of the world. But students, they say that after the live session, they feel that how the study is, they feel very energetic, they get hope, they understand how to study, they understand what type of study pattern is needed from all the sessions. If you just know the feedback, you'll understand that they find themselves a different approach towards the study schedule. That is very important. I strongly suggest attending the live session, but still, if you guys can't do it, it's okay. The recording is always there. You can listen to the recording as many times as you want. Live session is everything, my dear. The whole module is there. The ones who are still waiting to join, who are messaging, please, the link is with you guys, because now I would be coming up towards the course curriculum and the daily schedule. You do have 200 USD off. Please put RFA limited offer. When you put that, 699 would go to 499. You can use this coupon for now before it gets expired, please. Right? The ones who are still here from the open group and who were saying that after the introduction, we would be joining, right? The first thing you guys have to do after joining, and if you can open the website side by side, please remember that on the top of your website, the first thing would be your daily discussion schedule. This is your key to success. Every single thing that is needed in Mrcog 2. So the first thing which I need is that please go on the top of your website and note down this daily discussion schedule so that you guys can manage that. Starting from 6th. Every single date of your daily schedules being given and what guideline you have to do to an extent till November and December, you know that every day what you have to do. How easy and how supervised you guys are. If it is 6th, you will do the Green Top guideline on nausea, vomiting in pregnancy and one talk article of 2022, the preconceptional care. 2 p.m. GMT, the moderator would come in the study group and she will discuss these guidelines with you in the form of important points and the questions. Every day, 2 p.m. GMT, live, the moderator would come and she would have the discussion on the topic as a reinforcement. 7th, you will do the NICE guideline on miscarriage and ectopic pregnancy. 8th, you will do the Green Top guideline. 2016 management of ectopic pregnancy. 9th, you will do cesarean scar pregnancy talk or abdominal pregnancy talk. 10th, you will do Green Top guideline, gestational trophoblastic disease, the molar pregnancy. 11th, you will do the Green Top guideline 2023 on management of recurrent miscarriage and talk on recurrent miscarriage 2022. 12th, you will do the NICE guideline 2025 updated on abortion care and the manual vacuum of aspiration. You're going to do that. And 13th, you will do revision when you will have the live session. Go back to it. You guys would have the live session of early pregnancy with me. With regards to the early pregnancy, it will be on 10th of July. Okay. Every live session which you guys would have, you should be knowing would be very important. That would be during that and you will understand with the daily schedule. So we will meet on 10th live with early pregnancy, all these topics to be discussed. You will have always one revision day after completing one of the module and going to the next module. Did you guys understand, everybody? Okay. With regards to this, all of you, all these students who are here, who are attending the daily session, I want you to be more smarter in a way. For example, if Anika, you have 7-7, if you guys have on 7th 7, if you have the commitment, for example, you're on night duty, I expect you that from 6th, you guys attend more. Did you guys understand, everybody? Right? If you guys are having some family function on 9th, I expect you to do the 9th topics a little early. I want you to be smart. Did you guys understand, everyone? You have your daily topics with you. There would be days when you're busy. There would be days when you have commitment. Did you guys get that, everyone? So according to the daily schedule, you should know, and this daily schedule is for every single module on your portal. I'm not going to show till December because all the PDF is already there on your study groups. It is in the documents, please, in Telegram. It's already posted on your website as well. All right. Generally, I try to meet you guys, Arunima, somewhere in the middle of the module. Why? So that you guys understand that, how the study pattern is rather than those days are over. All right. Okay. Vanaja has a recap for all of you, please. Daily self-assessment first. Well done. Read the topic. Do the self-assessment again. Follow daily question discussion 2 p.m. GMT. Daily important group discussion and daily open group discussion. Very well done. This is the outline which she has written for every single day for you guys, which you're going to follow daily. Can you please all read Vanaja's recap? Everybody on the chat box. Please read this recap so that you guys understand what you have to do daily. Am I clear? Anika, the premium discussion group 2 p.m. GMT every day, you're going to have the discussion on the daily topic. Right? 2 p.m. GMT. Am I clear? 4 p.m. GMT, you're going to have the books. I can write it down here. 2 p.m. GMT, you're going to have in the premium Telegram group the discussion. 4 p.m. GMT, you're going to have the books discussion daily. All right. Okay. Did you guys understand, everybody? Yes? So Zainab, BAM and daily discussion schedule, we are supposed to read the guideline first by ourselves, followed by the moderator discussion. It's your choice, Zainab, because I don't want you to be whole day, sitting idle. If you can read the guideline in the morning, you can reinforce that at 2 p.m. GMT, my dear. Okay? But if you have not read it, then you can start reading at 2 p.m. GMT as well and then complete it before night. Got it, my dear? Books discussion and Upama would be in the open group where 12,000 people are there. All right. Okay. Did you guys understand the discussion? Now, this whole daily schedule, I'm not showing everything, fetal infection, maternal medicine. For every single thing is there. I'm not showing till December, but it is made till December and it is on your portal. So you guys exactly know that what is needed out of that. Okay. So it goes till December, till the end, everything is given. It ends up at 4th of December. Am I clear? Now, this is not as like one time you're doing. When you guys complete your obstetrics, you guys start revising obstetrics with gynecology, right? Okay. So this is the most important thing that you guys have to understand. As I told you that everything which is given in a set pattern. Now, can I please have an attention here? Can I have the attention here? You have video recordings and written for the guideline summary. You've got all the algorithms which would be in my session for the SPS and EMQ. The 12 moderators are there, which would be in the back end, which would be supporting you for your studies, 24/7 answering queries. Every single module would be covered up by a mock exam. Before that, there would be self-assessment quiz, which is for each topic for you guys, which tells you where do you stand. For every TOG article, there is a summary and there is a single best answer that's been given that you have to cover up. So every single content has got its summary, has got its flashcard, has got its single best answers, the question pool to be covered. So easy it is to navigate. This one thing which is on your portal, if somebody has not seen that, please let me reassure that 99% of your questions would get solved if you read that. For tonight, please take out 1 hour and read these 32 pages for me. Every single page is your question. This welcome pack, which the website team has made, is fitting in for every info that you need. Starting from how many groups are there, how to access the premium groups, how to navigate through the Telegram groups, how to locate the file in the study resources, how to find the Telegram channels, how to use the website, how to do the course schedule understanding, what is the exam aid, what is the guideline summary, when are the live sessions, where are the mock exams, where are the module-wise summaries, what are the TOG SPAs, what are the TOG written summaries, and what if we get technical problem and what is the solution to that. Every single thing is given in a way that you click on that link and you go there. This is the smartest way of approaching to the course. And if you don't use this, of course, you will have troubles to understand. But if you will use this appropriately, it would be very, very easy. Every single thing has been covered there. Every single thing they have explained there. Please go through that and everything you will find it very clearly that where the course schedule is, how you have to log in, where you're going to find the flashcards. If you see the last minute recap points, where are those algorithms, how I have to find the GTG flashcards. Everything is beautifully given on the website. How do I find the one pagers of the guideline? How I'm going to find the live session, where I would be playing that live session? What is the speed of the live session if I want to fast forward? What is going to be the way to find out the modular summaries rather than the detailed summaries? Please pay attention here. You have two types of summary columns, please. Number one, you have all the GTG summaries. You have the nice summaries as separate portal. You have the talk summaries, but then you have module-wise summary. You're starting with early pregnancy. So in early pregnancy, when you'll open up, relevant GTG you will find, relevant NICE you will find, relevant TOG you will find, relevant SIP you will find. This makes your life easier. You will not have to search everywhere. Okay, go to the GTG column, go to the NICE column, go to the TOG. Just under that module, you'll find all the summaries of the module. And let me tell you guys, my students, they do early pregnancy in just 1 day before exam. It is same, Vanaja. It is same. It is what? That we have put it in two ways. One, that if you're doing all the GTGs, you can revise. One, if you're doing module-wise revision, you can simply open up tick, 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 and you revise everything in one go rather than changing the folders, you know. Summaries are same. It is how they have been made easier for you. As a student, you can just open the module. And students, they do tell me that, ma'am, we just revise early pregnancy in 1 day. We complete the early pregnancy in 1 day. Did you guys understand, everybody? Every single thing is given there. Then your mock exams, how you have to solve the mock exams. If you want answers side by side, if you want to take your test and you want to do that in the end, then how the TOG single best answers would come up, how you're going to solve the TOG answers, how would you get your results there. Every single thing is very clearly given. Could I make myself clear? Did you guys understand how your exam pattern looks up? Right? So you should be knowing every single thing when you reach out there. When you reach to the study group, your MRCG2 Premium, daily you are posted up with the summary of the topic. In the morning, early morning, in fact, I tell the moderators to post it night before. For example, you have the first guideline if it is an ectopic pregnancy. So previous evening, you'll get the important exam bullet points for the same. Yes, you can do it as many times you want. You just need refreshing. Please see here. For example, if your today's topic is, everybody please pay attention. If your today's topic is NICE guideline on cesarean birth, you will get the cesarean birth highlighted points 1 day before because it's tomorrow's topic in your premium group. Done? You will open the mock daily self-assessment quiz and you will have the same sequence as in there. For example, your day 1 daily schedule is nausea, vomiting, and for example, surgical management of miscarriage. You will have the same daily schedule self-assessment quiz. Day 2, ectopic pregnancy, cesarean scar. Day 3, advanced abdominal pregnancy and management of ectopic. Your self-assessment quiz would come in the same way as per the daily schedule. And that is so easy. Day 1, day 2, day 3, day 4. So you open that day. I'm at day 1 of my course, right? I'm at day 2 of my course. I'm at day 3 of my course. And you revise them and you do that. More than 99%. It covers everything, friends. Everything. Then, please, the newcomers, please open up the pinned messages because all the details have been pinned. Everything has been pinned. You should know that once you start up, the first thing on the top, you would see the welcome pack. Please click on the welcome pack and read it thoroughly tonight. You have your daily schedule given. Number 1 is welcome pack. Number 2 is your daily schedule. And number 3 is your live session schedule. So if these 3 things you know, you exactly know what you're doing in the course. I don't want you guys to waste time on these things. I want that you guys basically start studying properly rather than waiting for this. You should be part of each and every premium group and you would be excelling after the welcome pack. All of you who had been asking for the daily books. So from 6th, we are starting up with Amanda Jones. This is the easiest, please. Right? And you would go ahead with Andre Sizer, then Brian McGowan, Tahir Mahmood, and we'll move with the books side by side in the open group. This is the pattern we are going to follow for the open groups, and you have all these books there in the group as well. All right, okay. So everything is going to be very organized. I want you guys to understand the pattern of studying, please. I would be opening up the mics, which I had made unmute because it was my turn. Please, the mics are open, and I'm here for the questions, please. Yes, please. Now I'm taking the questions. In fact, those questions which I felt that they were important and I couldn't answer in between because I was explaining the things, please, I'm here for them. Open group for all, even MRCPI students can join. Yeah, that's not a problem. But why would MRCPI students join the open group? Because that is MRCPI students are doing their separate group, open group, right? So what would be the benefit of joining MRCOT 2 open group? But they can. It's an open group. Everybody's there. Suhanda, when do we start to solve the mock exam in the website? Okay, let's take it one by one, guys. Self-assessment quiz is prior to reading the guideline. Mock exam is on the revision day. After early pregnancy, you have one revision day, right? Okay, so that revision day, you do the mock exam. Or when you have completed your complete schedule of the early pregnancy, then take the mock exam. Take the mock exam when you have completed the curriculum. All right, how to navigate through the book questions. What does that mean, Asma? Please expand your question so that I can answer the question. When you say navigate through the book question, what does that mean? Mira, ma'am, how can we efficiently read the guideline as you said in the required time limit? Mira, see the pages and give 3 to 4 hours. That's it. 3 to 4 hours, read the guideline, highlight the important points. Then after that, see the summary. The summary points should be all remembered by you. So, then you understand, okay, I didn't miss any point. So not more than 3 to 4 hours. There will be proper schedule for self-assessment questions. Sorry, Zainab, the daily schedule, self-assessment questions you're going to do as per the daily schedule. And daily schedule has been made for 6 months. Okay. Hina, where are the books, ma'am? In the study resources, Hina. Open the study resources, please. If you go to, again, the welcome pack, that would give you the link. All right, Anupama, ma'am, I always make notes so I can retain without writing. How can I change this? No, please make notes. Anupama, that is must. If you make notes, that is the best thing. I am a person, I still read my notes to teach. I teach from my notes. Please do that. Okay, Anna, my MRCPI question, is summary enough for the whole guideline? This is Anam Gul, right? Thank you very much, Anam. I think 2, 3 Anams are there. So please write Anam Gul so I can remember you and I understand that this is that Anam. Anam, read the guideline if you have time. If you don't have time, then read the summary. So it depends on your duty days and depends on your free days. Free days, please read the guideline. Otherwise, only summary, okay? Perfect, my dear. Maria Javed, can it be passed if I'm giving Janet 100%? 100%. Today, you give me this oath, you give me 100%. We are going to pass in Jan 2027. This time is absolutely sufficient, friends. Ma'am, guidelines are very lengthy. I do not agree. Early pregnancy or guidelines are very small, my love. Zishan Fatima, very small, please. Not lengthy at all. Not lengthy at all. Yes. Is it possible to cover syllabus in 3 months? Not 3 months, my dear. We will cover in 5 months. Yes. We make notes of guideline? Yes, Anam. If you make notes of guideline, that would be good. That would be good. All right, ma'am, nice or lengthy? Yes, if nice or lengthy, very less points are needed from there. Do we cover recalls and RFA? Hina, Zada, very, very less coming up in exam, but from September, we will be starting the Telegram group activity for the same, okay? Pass percentage is a difficult question. January, the passing overall results were lesser as compared to the previous, but to be honest, it is something where the percentile goal is around 64%, roughly around 64%. Okay, I mean 62, 64, this is the passing. I would be updating you in 20-25 days when the result of this part 2 would come. 6 months enough for everything, reading, revising, and solving books. Yes, Fozia, 100%. People do that in 6 months' time. Why can't you? We can do that. Yes. How do we know that which questions will be discussed from books the following day? When you start the book, so question number 1 to question number 50 is done from Amanda Jones. Next day, 51 to 100. So you know you're following the book, right? So if you're following the group, they'll tell you that, okay, till question number this, we have done. Right? Understood? Book discussion is daily. Yes. Daily book discussion is 4 p.m. GMT. How will we discuss books topic wise? No. We will discuss book cover to cover from one start till the end. How do we prepare for the book discussion? You don't have to prepare. You just have to do. Please make mistakes and correct yourself. No problem. My question, please. Yasmin, please type it again. Fahima, ma'am, I'm worried if I miss a guideline, I'll be demotivated. Fahima, I don't want you to miss guideline. Please at least do the summary of that guideline. How to make notes. Seema, in the first session, when I take that session, you'll understand the write down those things. The recommendations are important. Try to make bullet points. Try to make algorithm out of that. Zishan, Fatima, book have wrong keys. How much percentage, Zishan? Maybe 5%. Yes, 5% of the total books might have wrong keys, but it's okay. 95% are okay. All right. Books we will do ourselves or just follow the Telegram group. Follow the Telegram group and whatever it has done. For example, Maria, 50 questions are done. Those 50 questions should be on your tips. On your revision, you can go back to this 50 questions. Okay. Do we get the recall of past 5 years? Ask Marshad. I do not believe in that. There's nothing like a term recall. When you will take exam, you will tell that broken question and that creates just confusion. You will understand, have a very good grip. The important exam tested questions would be done in the Telegram. How many total guidelines are there? Alia, please open up the daily schedule. Every single guideline is there. You can count because they are numbered there. Okay. Ma'am, if I can allot only 2 to 3 hours a day, is it possible for me to get through? Wanaja, it depends upon what you're doing in those 2 to 3 hours. 3 hours for now, for 2 months, July and August, I can agree with, but in September, you have to increase the hours for me, okay? 3 hours, focus 3 hours for July and September, I can agree with. But after that, you have to increase your hours for me. All right? Mim Sultana, how long will it take for a live session to get uploaded in the website? 5 to 6 hours. The website team needs it for the conversion according to the website pattern from the Zoom. Sure. Okay. Anupama, will we have a fast track course? Yes. Like all courses of RFA, we have the regular, we have the fast track. The fast track would be started on the day of your registration, somewhere in November, October and November. Okay. They will be posting MCQs from the book daily, like 50. Here, it depends upon the type of the questions. If they're smaller question, it depends upon they can go till 50. If they're bigger questions, they can go on 30. So at least 1 to 1.5 hours practices daily. My ideal revision for the exam and how to incorporate into the schedule. So start with the early pregnancy, start the obstetrics. When you complete obstetrics, start revising obstetrics with gynecology. So do the new thing, revise the old. Do the new thing, revise the old. Okay. Can I study for both part 1 and part 2 side by side? I think you've got an individual situation. According to your circumstances, because other commitments are less, you can. Because the others who are working like, 24/7, having a difficult hospital routine, for them it's difficult. But for those who are actually not having a very tough hospital routine, you can do that. That would help you in your July 27. So for you, my suggestion is, my love, that you do the Green Top guidelines and do the daily schedule on your own pace. Don't be hurried on the cost of, because of course you have to pass part 1 earlier, but it will help you once you join NMRCOG 2 July 27, right? So at least your GTGs and NICE should be on your tips. That would help you in your clinical data interpretation for part 1 as well. All right, you can do that, my dear, knowing your routine, okay? Preparing for September OSCE, how to organize the schedule. Yasmin, that is a little tricky because after September, I can get your time because I don't want your September to get affected, I know that is also my result, OSCE. So what I want is that for MRCP OSCE, you are in the batch. Concentrate on that. And from September 11, 12th is the exam, right? 12th, 13th is the exam in September in Abu Dhabi. So what I want is that in that exam, we go ahead, we do the things earlier. With regards to after that, I want more time with you, 8 to 10 hours to complete July, August curriculum, which we have missed. Now you have to concentrate on the September exam. Okay, right? because I really want that your MRCPOSKI gets completed, my dearest. Okay. So if you read 2 to 3 hours a day, it's enough. Fahim, I won't say it's enough, but at least it's better than nothing. So we can increase it to 4 hours. That would be great. Anam Hassan, the daily discussion in Telegram group, we have to make notes of them too. No, one note is enough. Either it's for your reading for the guideline or it is for the discussion, right? Okay, Seema Zafar, book schedule share, please. It's in front of you, my love, on the screen. I hope you can see that. Seema, do we get the talk from our account? Every single talk article, every single resource material is posted in the group. Everybody, please pay attention here. What is your topic for tomorrow? Everyone, what is your topic for tomorrow, for 6th? Quickly,
Early
not a difficult.
pregnancy.
Very well done, Vijay. I'm
Early
proud.
pregnancy.
What topic? Come
Nausea
on.
and vomiting.
Very well
GTG,
done.
nausea and vomiting, sorry. Preconceptional care
Talk article.
on TOG.
Okay. So this is your topic for 6th. What is the date today?
5th July.
So 5th evening, team is going to put PDF, nausea, vomiting, GTG in the group, and will put PDF, talk article of the preconceptional care. Got it? One day before tomorrow's topic, they put the PDF. So tomorrow you can see the PDF, you can see the summary from the website, and with that, they will put the bullet points of the important for this topic as well. So what else do you need? One day before. Why initially they used to put in the morning, and then morning for everyone was different in different part of the world. So I've told them to put one day before so that everybody on their time when they wake up, they have that PDF and everything. Got it? Okay. This is for Zela. Okay, ma'am, do you recommend question backbone for notes for daily book discussion? No. Whatever questions we are doing, they're more than sufficient. Anika, any tips on staying motivated and catching up? We've missed one day and fall behind. Anika, I'm just a message away. If anytime you feel demotivated, I'm all here to give you all the energies with my voice notes. I do have the motivating sessions. I do have the self-assessment sessions for this case. I won't let you get demotivated. Please drop in a message if you feel so. Anybody in the course feels demotivated, please WhatsApp me. Do you all have my number? Do you all have my Instagram? I am a message away. Please message immediately so that I can take you out of that shell immediately. Please. It's okay. We'll miss the guidelines, but we don't have to feel lack of focus should not be there. Ma'am, do we have a fast track course of part 2? Yes, we do have an Upama like others. Whatever needs to be studied will be posted in the premium group. What if it takes a few days to align ourselves on the curriculum? It's absolutely okay, Sumi. That would stay there in the course schedule, okay? E-learning days are, I didn't want to confuse you guys, that's why I didn't announce, but since you're asking, I'll tell you it's Thursday. No, guys. It is Wednesday and Thursday. Note it down, please. Wednesday and Thursday, 7:30 a.m. GMT, e-learning sessions are there. Okay? E-learning sessions are there. That would be there on Wednesday and Thursday. Noted? Shall I write it down again, once again here? Let me write it down on this good luck mug. Okay, please pay attention here.
This e-learning is recorded, madam. I am unable to attend.
No, it is a Telegram discussion. So you can go to the group, it would stay there till your exam. Yeah. 2 p.m. GMT, daily discussion topic in the premium group. Done. 4 p.m. GMT, books discussion in the open group, the schedule I've given to you. And 7:30 a.m. GMT, e-learning in the e-learning group. That would be Wednesday and Thursday. Okay, these are your timings for now. One more thing, please. Note it down, guys. I'll just make a quick recap for everybody if still somebody has not understood. You will follow daily schedule. You will have daily discussion in the premium group with book discussion. You will have live session of that module. Then you will have grand revision by the chief moderator in that module. After grand revision, that would be a Telegram revision. Then you will take mock exam of that module. You will have self-assessment quiz question pool of that module. So I repeat once again, you take the self-assessment, you do the daily schedule, you attend the live session, you have a grand revision, you have a mock exam for that daily schedule, you have daily moderated discussion for the same, you take the mock exam, and then you move to the next module. Could I make myself clear? Did you guys understand that how one module would be organized and why we have a difference in terms of reinforcing where do you stand? I hope I'm clear. Did you guys
Ma'am,
understand everybody? Yes, please.
yes,
Yes,
ma'am.
ma'am.
Thank you so much, ma'am. It's great discussion. Ma'am, could you please clear it to me that we are having the daily discussion and then it will be followed by self-assessment and then we are supposed to do the self-assessment by ourselves. Or there will
That is on your
specific.
website.
Okay, ma'am.
Zainab, self-assessment quiz you can do prior or after. That's for your assessment out of the guideline that where do you stand, a quiz. So you want to do it early, it's okay. You want to do it afterwards, it's okay. But you have to do it because it would tell you out of that topic what is your grip. That is not any college pool. That is like we have made from the guideline, from the lines of the guideline.
Right.
Got okay? Any other
Yes,
question?
ma'am.
Is it necessary to read the whole guideline if you read the summaries in the Telegram group with lectures? Asya, if it gives you satisfaction, go ahead, my dear. Did you guys go to the Instagram and see Sujay Gupta's testimonial? Anybody by any chance saw Sujay Gupta's testimonial? He just cleared one of my students from India. He just cleared MRCOG Part 3 in the recent attempt with us in Delhi. And during that testimonial, he said, I am MRCOG today. And let me tell you that it is not encouraging for all of you. But till date, other than ma'am's session and other than ma'am's guidelines, I have not read, I have not opened any GTG myself. I have not opened any of the nice myself because what I retain is from ma'am's session. So I told him, please don't say that. This is not ideal, Sujay. But he was like, ma'am, I have to tell everybody that I'm so used to of your voice that done. I will post that testimonial for you guys, but depends upon how you are. So I used to tell Sujay that please read the guide, and he's like, ma'am, it is in front of me, but I do not retain. But when I listen to you, I retain. So start with this schedule and then see, how your productivity is better because everybody is a different student. I have my different way. And the way you had been studying for years and years, you can't change it now. Like Anu was saying that, I'm a notes making person. So it's all right. Your pattern, you have to do that. Okay. Ma'am, one of my friends who cleared from this group haven't either. They only did summaries and live sessions. Many students, they say that. Many students, they say that we just remember your words, we learn your words, and we do that. But see, I can't say that to everybody who is the type of a person who would not get satisfied without reading the guideline. If you do it, and then you don't forget even a word because I explain every important thing. That means that you're a type of a student. That is something, I mean, whatever I'm doing in the session, guys, is every single word important. Every single word would come in exam. To an extent that students, they do say that, it seems that ma'am has made the paper. It's just out of experience because I know how the pattern would be, how the important things would be asked, how they twist the lines of the guideline, how they make the tricks out of it to make you get confused in the follow-up of molar pregnancy, how they would just change the lines to make it a trick for you guys and you have to pick it up. So it is just, I'm very humbled. It's just out of experience, because of teaching experience, because of being in touch with or learning. When I read the guideline, I read it in a way, okay, how would the question be made from this? And when you read the guideline, of course, you read as a learning pathway. So there's a difference between the approach of the guidelines between us. And that is the reason that after the session, the things are a little more confident for you guys and you feel better in heart that, we know the guideline, we can manage that. And that confidence is needed, honestly. Right? Yeah. E-learning Wednesday, please explain, ma'am. What do you want me to explain in that? Wednesday and Thursday, 7:30 a.m. You will go to the group and you will get the important questions there. Okay. You will make notes from my session. No, you have to do that, my love. Yes. Thank you very much. Any other question? Thank you very much. Team has made, oh my God, look at the team. They have made, I think, Sujay's reel there. Can you guys see Sujay's reel here? Yeah, you guys can go to RFA Instagram, or you can copy that later after the session. You can see. Thank you very much, RFA. My backend team is swift, guys. So is it necessary? Oh, I see. Thank you very much. Thank you. So is it necessary to go? Yeah, you guys see Sujay, and you guys would see that, Sujay is one of the outstanding who's always like a backbencher to me, but I was telling him that you have done amazing. Is it necessary to go through the website summaries if you do the entire guideline and bullet points? Arunima, I would tell one thing that, see, if I was at your place, I would read the whole guideline, make the bullet points, and then in 5 minutes scan the summary. Why? Just to see that everything I've written, because summary is made by expert and your own guideline, you might miss some points. So give only 5 minutes to the summary. Don't learn the summary, compare the summary to your notes. Do you get what I mean? Arunima, did you get that? Just compare it, my dear. Right? Okay, what is the difference between e-learning and daily discussion? So daily discussion is the topic they would revise with you, and e-learning are the important exam-oriented questions, Okay, that is like expected from the module. All right. Huda, always feel good listening to your voice again. You will pass. All my Malaysian students, ma'am, loves you like anything. Malaysian RFA alumni, Singapore and Hong Kong RFA alumni. You're part of me. And Huda, thank you very much. All the love, all my heart for all my Malaysians. Thank you very much. So e-learning question updated every Wednesday and Thursday, and it is an updated question. Meera, thank you so much, ma'am. This session was much needed before starting off. I'm right there. You guys would not miss me anymore because every other day we'll be there. We will keep on meeting for the motivating session. We'll keep on meeting for the self-assessment session. We'll keep on meeting for where do we stand now, for the problems. So many times students, they ask for a session apart from the live session for the family problems, how to deal with kids, how to deal with husbands, how to deal with wives. And we're going to discuss everything. This journey is not only a mass theory. You'll be a very, very changed, better, focused human being, a practiced, your clinician practice would be changing as well. You would really be outstanding after the course. This is what students, they feel the difference after 6 months being with us. Can I ask a question in voice? Mariama, please open up mic. I am all happy to do so for you. Thank you so much, ma'am. You're a godsend. No, it's just like I'm a very tiny creature on this planet, but yes, teaching comes from inside. And I feel that everybody has got a purpose on this planet. So one of the purpose I think I find it's very, very rewarding all over the world. So I'm so grateful for all globally to all the RFA alumni and mentees. Please, Sadaf, you raised your hand. Please let me know. I feel I'll do it with the motivation. 100% Anupama. You will see the energy I will give to you guys during the session and the way we'll work hard. I am sleepless one day before the session. I'm still working on your early pregnancy to make it updated, to make it according to the recent exam pattern, and then I expect that I get the same energies in return as well. As I told you that you'll find me lovable, but you'll find me very, very strict in certain points as well. Somebody wanted to unmute, please, and ask the question. Mariama, was it you, please? I'm here to listen to you.
Hello, ma'am, and thank you for this nice session. Sorry for interrupting you, but the last time when I started reading Mrcog Part 2 and just reading the whole guideline I think I didn't remember the title. Just broke up with with nothing to read. I was very depressed until I found your group, RFA. That's why I just have a question. Can I just read and memorize all the summaries, then make a note with daily discussion and get all of the daily routines or for all of the groups and the revision, just not reading the whole guideline, because sometimes it takes more than 4 to 5 hours just for reading for me.
Mariama, listen to me. Let's take early pregnancy as a trial, okay? Then you'll get connected to me. You have got my number, right? Yeah. So what you'll do is that from early pregnancy, the first 3 days, you will do the summary And then you'll scan the recommendations and then you'll make sure that your notes are complete. When you'll attend the session, those notes will be in front of you. And then you'll analyze that, are you feeling confident? You'll do the self-assessment quiz. And then after the mock exam, you'll tell me that what did you score and where do you stand? I can give you a chance of one module as a trial, hit and trial. Okay. After one module, early pregnancy, you'll tell me that what do you feel? Are you confident? How did you make your notes? You'll send a picture of your notes. I'll see that, I'll review that, is it very short or is it enough? And then I'll allow you for the next modules. For early pregnancy, you do the way you want to do, but then get it checked by me. Because I don't want that, this is a smaller module, I don't want that all your modules get affected. Got it? Okay? Deal done? I'm doing a deal with you, Mariam. Where are you? I think, guys, Mariama didn't like my deal. She's okay. She says thanks. Oh, sorry, I was not seeing the chat. Thank you very much. Love you guys. All right. Vishali says, ma'am, the e-learning questions are related to the daily topic. They will be related to the module, sweetheart. So you're doing early pregnancy. So Wednesday and Thursday, you'll find early pregnancy questions. Okay. No, not random, according to the module. All right. Whatever needs to be studied will be posted in the premium group one day before. What it takes us a few days to align ourselves to the curriculum. Absolutely, Sumi. It will be posted, my dear. The self-assessment quiz, same as daily discussion questions. No, they're different. They're different, my dear. Okay. Ma'am, what is the score needed to get the gold medal? Aisha Hassan, that's like a cohort of people who are saying, would we pass or not? That was the question I needed. That's like my student. So, so for the gold medal, the student of ours who received the gold medal in the last 2 to 3 years, RFA had been lucky to get. So basically, you have to pass MRCD 1, 2, and 3 in one go. That's the criteria number one. If any of the exam you have taken as a repeat, then you're not eligible for that. And generally, the part 3 has to be the highest score. Part 1 and part 2 has to be in one go. I mean, you shouldn't have a repeat attempt for that. You should not be failing or taking it again. And part 3 should be the highest score. Got it? Okay. So the highest score in part 3 for us had been 92% and then 89%. All right. Okay, inshallah, my dear. Thank you very much. Any other question, guys? So somebody asked in the chat box when I was taking Mariama's question that how many books we should make, notebooks. It depends on you. If you make module-wise small, I think it would be fine. So let's write down the books, guys. I'm the type of ebook person because I do that on my Apple. Reason being that in traveling and all, can't carry all the books. So I just, do the iCloud between my iPad and my MacBook and my iPhone. So I have the connectivity. I am that type of person. But if you want physical books, so you will make number one module wise, each module one notebook. Or if you're doing on lease, each loose sheets like A4, you can make the spirals and you can put those sheets together and you can do it that way. Right? Module wise, each module one notebook. Second, make e-learning one notebook and put one-liners there. Then later, when we'll do the exam tested questions, recalls one notebook and make one-liners there. All right, so this would be enough. What about the reproductive medicine topics? What does that mean, Malika? What is the module reproductive medicine? Fertility. Malika, what do you include in the reproductive medicine? Just give me a second. All right, sorry. I just joined now. Is there any discount in the premium course? Asya, please use the coupon RFA limited offer. It has been activated 2 minutes. 2 hours back, limited offer. This is the coupon, Asya, please. And I think it's been posted in the open group as well. I'm sorry, my pen is saying that it's time to back up. RFA limited offer. Okay, right? We don't need that, Malika. We just do the fertility nice guideline. You're appearing an exam as a stage of ST5. You don't need to do it more than that, okay? The details of the ICSI IVF are not needed. Very superficial question from the NICE fertility are needed. Thank you very much, Asya. Not a problem. All those who are yet to join, please, when you join in the middle, there's a backlog, then you ask questions. I want you all to help them as a family because very tiny questions. Again, I would like to request that please go through the welcome pack. Your life will be easier. But we are here to every time. But I could see that few of the students were saying that the same question is being asked again and again. It's okay. It's your right. Of course, we are here to support and help. But if you will go to the welcome pack again, your 99% of the queries would be addressed. Okay. Thank you very much, Anupama. I'm so proud of you. Can we join after the results come out first? Omar, I would suggest now for part one students. Why? Because 1 month is a huge time to cover. I'm sure of your results that you guys would pass, but God forbid, if you're not able to be successful, you guys can freeze the course and utilize the part one. Okay? Right? See, the website team is writing again and again, welcome pack, welcome pack, welcome pack. Please read the welcome pack. They have spent their nights on making that welcome pack. Please read that so that you guys can basically answer all the questions yourself. Can you give intercession on MRCPI versus MRCOG, please? If you have any question, Alia, you can ask me. Otherwise, I have a complete intro session of MRCPI. If you want, I can send it to you September 26th, where I did make a comparison. Right, Alia? I made a comparison in September 26th, introduction of MRCPI for Ireland. If you want that, I can send it to you. It's on YouTube. Yeah, sure. I can send it to you. No problem. Any other question, guys? Sure. Ma'am, how many hours should we study daily? For now, 3 to 4 hours is enough. For month of July, for month of August, 3 to 4 hours is okay. Sure, Omar. Omar, drop in a message on my WhatsApp, please. Drop in a message on my WhatsApp. You guys know my WhatsApp, right? Please, this is the number. This is the WhatsApp for me, and this is the WhatsApp for the website team. And you all should know my Instagram as well. You can drop in a message on Instagram. Live sessions of how many hours? I generally make a live session, but sometimes it goes beyond that depending upon the question and answers. So my preparation or my content is 3 to 3.5 hours, but it might go to 4 hours as well. Okay? Right. Any other question? Thank you so much. I'm here for the question. If any question, anything is not clear, anything you want me to repeat, I would be there in the study group. But I hope you guys understood that how the pattern should be, how the pathway would be. Thank you very much again for having the faith. Throughout the day, I keep on receiving these messages that my senior passed with you, my friend passed with you. I have got a reference of my junior. One of the consultant joined yesterday saying that my trainee passed with you, and she encouraged me that, ma'am, you can do it, Sidra ma'am. I am very, very humbled and thankful to the Almighty for this love, for this respect. Again, I feel that it's all the hard work and it's all the blessings and it's all the love and the word of mouth. And I always tell to the website team also when they think, and the marketing team always, I tell that there is no marketing as word of mouth. There's no marketing as hard work. Your work speaks for your staff. So all of you, I tell to my backend team, I tell to my moderators and coordinators always that you work hard, you get the results. And this is always that no poster would do the job. Only the word of mouth works when it comes to standards. I would work hard with you guys, but I need lots and lots of support from your side because at the end of the day, I'll keep on teaching from my heart, but you have to retain that. You have to revise that. You have to show me results. We have to stay in touch. Just be after me. Keep on messaging me. Keep on telling me that, ma'am, we need this. We have this problem. We need solution to that. How the things are going. You need an improvement. You want things to be better. Or if you're improving now, keep on reassuring, keep on reinforcing. If you feel down, keep on informing me that, ma'am, I am not able to do this. This is the problem I'm facing. I'll tell you out of experience that what you can do, out of the experience of many, being as a student and then being as a mentor, that what you can do to come out of that as early as possible and be focused. All right. Where there can be 3 exam dates for MRCT2 exam in a year. Yusuf, not exactly in this year. In this year, we are having 2 exams, January and July. Thank you very much, Sana. You all would pass with flying colors, and I am very hopeful for all my Part 1 students. Thank you very much. Part 2 is hard, but that doesn't mean that you escape. Definitely, MRCOG is a bigger degree is a bigger college as compared to RCPI. That does not mean that you should not do. You should do MRCPI as well, but that does not mean that you go away from MRCOT. All right. Okay. Thank you very much. Neelam wants my Instagram. Somebody can put my Insta handle here, or I'll have to do that. Just keep on seeing the motivational stories, guys. So copy link. How do you share the profile on Zoom, guys? So on Instagram, if you search at the rate of Sidrali Mentor, you'll find me. Thank you very much, backend team. This is my Instagram. Drop in a hello. I would love to get connected to you guys. And regarding the WhatsApp number, it's on the screen, please. I'll highlight it once again. So this is the WhatsApp number. Please stay connected for this 6 months. I'm all yours for this 6 months. And the team has sent my Insta handle. You can just click on that and drop in a hello after following. That would be in my inbox. So if any message you want to give, if any video you want me to make, if anything you feel that you are facing difficulty, I'm right there to support you guys. Thank you so much. Thank you. Alia Yusuf, I got your message. Thank you very much. I'm going to answer your questions in a bit. Anything before we call it a day? I'm going to see you guys with early pregnancy. I want an oath. I want to promise that today, when you have 2-3 hours, please think about it. But once you have taken a decision, no looking back. How many of you would give their 100% to pass this exam in January 2027? Can I have a thumbs up, please? Can I have those lovely students here who would fight back each and every day, who would face the difficulties and challenges and not get down on this, who would face their family members and be so smart in handling the family politics and clear this exam, who would not feel down despite the difficult situation and despite having those ups and downs. The hospital rota, the consultants, the seniors would disturb you, but they would still fight back till the end. Every single morning, tell yourself that it's a new day to be closer to MRCOT2. We are taking this oath today on 5th of July 2026, and this MRCOT2 January 2027. We have to make this success together. Thank you very much. With all this love, with all this hope, let's have 15 seconds of prayers together. We are starting this new journey. May the Almighty be with us. 15 seconds of silence for all the faiths we have in this different part of the world. I have strong belief in togetherness and prayers in together. 15 seconds of silence before we call it a day, please. Thank you. Ameen. Summa Ameen. Thank you so much. With all this love, with all this prayer, starting another batch with you guys, with this hope that we would be better, with this responsibility on my shoulders that I have to make you guys successful. Let's be hands in hands together in this journey. Let's work hard with the same enthusiasm. Let's not forget that what we are aiming today, and let's make it a success. Thank you so much, Asma. I want lovely emojis here. I want all the love together. I want the study group to be the strongest family, and I want this batch to be the best batch of RFA in the history, showing the best of the result. All the top scorers have to be from January 2027 RFA batch. Thank you so much. Take very good care of yourself. I've called it a day, guys. I'm going to see you guys in the premium study group. With all this love, your mentor says bye-bye. Take very good care. See you in the premium group with all the energies, with all the love, with lots of hard work, and see you in the live session. Take care. Lots of prayers. Bye-bye from my side. If any questions are there, please do not hesitate to stay in touch. Thank you. Bye-bye, everybody. Take care. See you in the study group. Thank you.